We were hoping to get your elevator pitch of current interests / research.
Well, my current interests with research particularly are looking at a study whereby we have patients go through a focused, observed, structured clinical examination, mainly dealing with just a cardiac assessment. But what we want to do is we want to have a control group through that and experience that OSCE, as we call it for short, in doing a cardiac assessment. But then in the study group, we want to add what we call a structured reflective activity or experience. And the thought is that given the observed assessment from a faculty member as a student goes and does the cardiac exam, if we also add in the reflective structured activity, then the student is able to evaluate themselves as well and do some structured self-assessment. And we feel as though that in doing so, they will actually come out with a greater competency than those students who actually come in from a control group. Because the biggest thing that we're trying to accomplish in learning is that you have specific understandings about those things that you know. So you can know how to do a cardiac assessment, but do you really understand what you're doing when you make that assessment? And we're hoping that we can show reflection activities will increase that knowledge and therefore show more competency.
Okay, thanks. Why do you feel this research is important for the medical field, and do you think there will be useful applications resulting from it in the future?
Well, learning theory has already shown us that if I ask a student to perform a cardiac assessment, then they've got to know basic things about a stethoscope, they've got to know anatomy, they've got to understand physiology, they've got to be able to know the anatomical landmarks, they've got to be able to talk about what they hear. But in using that in real world circumstances, it's never predictable. And so we have to be able to really know how to do a cardiac exam and how to make that assessment process work for us, because we have to interpret it, we have to analyze it, we have to dig deep into what's going on in the context of the patient presentation. So if we can get students to the point where they just don't know and understand, but they truly actually are able to conceptualize and make deeper inquiry and also look deeper into a subject with more effective learning, then they're going to be able to apply that to any situation. And therefore, I think that makes them better physicians. I think it allows us to give them more meaningful education, because our goal is to add more assessment modalities to what they're doing so that the student is able to assess themselves more, and we're able to assess themselves or assess them as well in making those validations of their performance or their outcomes.
All right. Final question / tip. If you could give one piece of advice to an aspiring physician, what would it be?
Relax. I think that as medical students, we are all very driven, and we've actually done a lot in our lives and in our journey to get to medical school, and we think we're just beginning. Some would say, okay, yeah, but it's that whole process of just living life that we're actually engaged in, and often we want to just stop everything so I can get caught up so that I can make good grades so that I can graduate medical school and get a good residency. And we really don't realize that in just a few short years, you're going to be an actual physician with a license practicing. Most of the students that come through our medical school graduate. Most of those students get a residency. Most of those students go into practice. So my thing is, relax. You got through 4th grade, you got through 5th grade. This is the same kind of deal.
Yep.
So I want people to just understand that, life comes, we've got to learn it. Who would have been able to predict this crazy pandemic that we're in right now? But it's one of the things where, that's life. So let's just live it. I mean, what we're doing right now is focusing on becoming physicians. Very noble. I think that as physicians or anyone in the healthcare profession, we're part of an elite group of people because there's not a whole lot of folks who want to do what we do, really. And there's not a whole lot of folks that can do what we do. And so I think that just relax, take life as it comes, and work your hardest. That's the way to go.
Well, thank you. That was very insightful.
Thank you.